Assalamualaikum warahmatullahi wabarakatuh, and very good evening to Dr. Azizah and also to the other fellow classmates. For today, our group will continue this presentation by explaining more regarding to the case study about collaborative governance. Basically, before we start our presentation, I would like to introduce our group mates. And the first, me, Ashraf, as a moderator for today, and panel 1 will be Safira, panel 2, Sarah, and the last panel will be Al-Hazi Al-Zikri. So as what had been acknowledged previously about the collaborative governance, literally or basically what can we understand about collaborative governance? Actually, it's involved about the government, community, private sectors communicating each other, and they try to work together in order to achieve something that could not be achieved by only one department, some sort like that. So, according to Ansel and Gash 2008, there are 6 requirements, or there are 6 criteria for us to understand regarding to the collaborative governance, and 6 criteria that have been discussed before about the forum is initiated by the public agencies or the institutions. And then the second one, the participants in the forum includes the non-state actors. Third, participants engage directly in the decision making and are not merely consulted by the public agencies. Fourth criteria is about the forum is formally organized and meets collectively. The fifth one is about the forum's aims is to make the decision by consensus. And the last one will be the focus of the collaboration is on the public policy or the public management. So, as what had been stated just now is about the definition and also the criteria that needed to be fulfilled in order for us to clarify either the certain collaboration or the cooperation may be considered as the collaborative governance or otherwise. So, I would like to start our discussion by opening the discussion to the first panel, to the panel 1, who is Safira. Safira, regarding to the 6 criteria that I've mentioned just now and also the definition given about the collaborative governance, actually my question about this, how do you relate the criteria given with any case study given by our group? So maybe you can present a little bit about our case study, Safira. You can proceed with it. Thank you.
Okay, thank you to our moderator, Mr. Ashraf. And first of all, good evening to other panel and to all audience. Okay, first of all, let me explain about the case study that me and other panel have decided to choose, which is the power of collaborative governance, which is the case study of South Korea responding to COVID-19 pandemic. Okay, let me explain a brief about this case study. Okay, the COVID-19 pandemic, it's an unpredictable crisis, which is a global crisis that emerged on 2019. And actually the case study that we choose is an action or response of South Korea government regarding the pandemic. So the case study is will explain about the they explores the synergy produced by the entire governance systems, and the system was participated by various sectors, which is both from public and private sectors. And in this case study, it states that South Korea government believed that the collaborative governance can be a more successful strategy if it will be a successful strategy during the pandemic, because the collaborative governance during the pandemic can control the transmission of the virus, also the pandemic, because if all of these sectors, the actors from both public and private work together, they can control the pandemic. Okay, for the criteria, first of all, the first criteria for collaborative governance, it should be initiated by public agencies or institutions. Okay, back to the case. In South Korea, respond to pandemic for their health systems, it shows that South Korea government does fulfill the criteria to be recognized as collaborative governance, which South Korea government work together with related sectors to create better system of governance. For example, they have developed holistic disease control system, which is enable massive testing and effective contact tracing during the pandemic, especially for the first wave of COVID-19 in South Korea. Okay, for the second criteria, collaborative governance should have participants, including the non-state actors. Of course, well, in this case that we choose, the policy decision was made and conducted by both party from public sector and private sectors, and these participants from both party are the critical factors why the country is successful to control the pandemic during the first wave of COVID-19 and the second also. Okay, in this criteria, for participants in the collaborative governance, South Korea responding to pandemic, the public and private sector that participates in the decision made for policies is the national government KDCD, local governments, private sectors companies, civil society, and of course the public. And the last one is the hospital management. Okay, this is why we choose this case study, because the case study shows that South Korea government work together with other actors in the country to control the pandemic. They made the decisions together while introduce or want to implement any policy. They work together to implement it. Okay, that's all.
Okay, thank you, Safira, for the great explanation regarding to the case study that being chosen by our group. And from your points, I may summarize it as we can see the case study is focusing surely about the pandemic of COVID-19. And then and you also has explained about the first criteria and also the second criteria that we can see from the case study, as we know that regarding to the first criteria, Safira also mentioned that it fulfilled the first criteria because Korea government is the one who stated that they need collaborative governance. Which means that they are the one who adduced the idea of doing collaborative governance. And the second one, it's also had been mentioned by Safira that many participants involved in this collaborative governance, like what had been mentioned about KDC and then private sectors company and so on. So that's the great explanation from Safira. And then I would like to continue this discussion to our second panel, who is Maisara. So Maisara, since Safira has explained about the case related and she already relate with the first and second criteria of the collaborative governance by relate it with the case study. So how's about your opinion about another criteria? Maybe you can discuss more regarding to the next criteria to be fulfilled. Feel free to answer, Sarah.
Okay, thank you, Mr. Ashraf. So I will continue with another criteria, which is about third criteria. Participants engaged directly in decision making are not merely consulted by public agency. And the fourth criteria is the forum is formally organized and meet collectively. So for the participant engaged directly in decision making are not merely consulted by public agency, what can be highlighted with this criteria is about participant and public agency collaborate to make decision making, and they want to ensure they achieve desired outcome based on the problem. Based on the situation in Korea, we can see that the government specifically public agency was collaborate to make people follow with policy or rule during this pandemic. So for instance, researcher media and media was participate to collab with public health to spread the news about the implementation of mandatory quarantine through self-isolation, social distancing, campaign, and so on. So by this consultant, they suggest to encourage people to know about this issue and make sure people to take serious and alert with this crisis. So at the same time, many policies organized by public agency to prevent this problem. So the actor who participate in public health emergency always respond to aware this situation. So for the fourth criteria is about the forum is formally organized and meet collectively. So for this criteria, I would like to clarify that collaborative government always organize forum formally. So this is because when something issue or problem crisis occur, so they need to find a solution. So they will create a new policy. So government will collab with many agency and stakeholder to discuss and hear hear their opinion. So during this pandemic, South Korea government was organized forum with stakeholder like private company, local government, and cooperate or sharing idea to come out the problem. So that's all from me.
Okay, thank you, Sarah, for the good explanation given. So, based on what had been explained by Sarah just now, we could see that in the case study that we discussed right now, the participant engaged directly in decision making, and it's quite interesting because, as what had been mentioned just now by Sarah, Sarah stated that even media also has taken part in giving the decision making, in giving their own decision making in order to give the good collaboration governance making by them and also by the public sector. So on the part of the fourth criteria that have been explained just now, I could see that it's truly structurally organized. The collaborative governance made by the Korea government, because we can see that all the policies that have been explained just now by our first panel, Safira and also Sarah, surely showing to us how the agencies, either by the public or private sector, being organized according to what their roles. So and then we jump to our third panel, who is Al-Haziq. So Al-Haziq, based on your point of view, what do you think about another last two criteria of collaborative governance related to the our case study, which is COVID-19 in Korea? Does it relate, or does it fulfill, or it's not fulfilled at all? You may feel to answer it. Thank you.
Okay, thank you, Mr. Ashraf and our panels. Based on the last criteria, which is the two last one, it does relate with the case of the Korea, as been explained by Miss Maisara. So the fifth and sixth criteria actually just like have an interrelation, just like a more deep about the criteria of the collaborative governance, which is the fifth one. Sorry, the decision making by consensus to make this clear, I will explain a bit about the several action that actually comes up with the forms of consensus. For collaborative governance to work effectively, government leadership is critical for bringing the participating actors together and facilitate collaboration and cooperation. So with the previous epidemics occurred in South Korea, the greatest blame was direct at the uncoordinated and response of the government. So the collab that happened between the stakeholders aim to achieve the target and indirectly conduct by the terms of leadership in consensus of making. So in the case of South Korea, the national government actually did the implementation of the new policies and enhancing the law in controlling the epidemics. Actually, from the policies be taken, also highlight about the law needed by the other stakeholder, which is covered the action or decision that adduced by them in handling the epidemics. Besides, actually in this collaboration, the two stakeholders, which is the local governments and the local medical organization, are one of the active actors in the collaborative governance, and they implement various local level policies in response to the infection. For example, local government they send alerts to residents via text message, such as and then publish relevant information like number of new confirmed cases, visited location, and travel routes of the confirmed. And then for the health service official in local public health facilities, monitor the quarantine. Then for the other two actors in collaboration governance, which is the public-private partnership and corporate engagement, action against the epidemics, they cooperated with the public sector, which is a few days after the first confirmed case, the government decided to bring around 20 medical companies together to come up with the ideas to prevent the pandemic, including the development of test kit. And then several companies have also managed to produce test kit quickly within that weeks. And then it usually takes a year and a half of diagnostic test to be approved by authority. But this time, KCDC approved the test kit within a week, which is very unexpected. So the example that explained mean that government successful achieved to make decision making by consensus, which is the criteria among the actors in collaboration government by the aspect of the leadership, the ideas, and the passions toward the controlling the COVID-19. Okay, consensus decision making is a creative and dynamic way of reaching agreement between all members of group instead of simply voting for an item and having the majority of the group. This means that the group, the 5 group inside the collaborative government using consensus is committed to finding solutions that everyone.
Can you explain a little bit, because your line sometimes sometimes loop a little bit. You just explain the latest point. Thank you.
Okay, test. I'm sorry. Is it okay now?
Yeah, it's okay.
Yes.
Sorry. May I know which part that I missed?
You may continue about after you after discussing about the consensus decision.
Okay. I'm so sorry for the problem. So
Yep.
I will resume back about the example that been explained means that the government successful achieved to make decision making by consensus among the actors in collaborative by the aspect of the leadership, the ideas, and the passions toward the controlling the COVID-19. Is it okay?
Yes.
Is it clear?
We hear you.
Okay,
Yes.
thank you. Okay. Consensus decision making is a creative and dynamic way of reaching agreement between all members of their group, which is involve 5 groups of the collaborative governance. Instead of simply voting for an item and having the majority of the group, that group they use the consensus is committed to finding solution that everyone is actively support. This ensures that all opinions, ideas, and concerns are taken into account. Through listening closely to each other, the group aims to come up with a proposal and action that work for everyone. And the 6th criteria, which is about the focus of collaboration, is on public policy or public management. there are many policies being done in collaborative governance of South Korea. The action taken actually was the main focus on the controlling and handling the pandemic that comes up with the policies. A number of policy decisions that have been made by South Korea have been identified by researchers and the media as critical factors in the country's successful management of that situation, including such as extensive of the testing, contact tracing, and effective social distancing campaigns. And then mandatory quarantine through self-isolation, the designation of COVID, especially hospital and treatment centers, categorizing medical facility based on the symptoms, and the establishment of drive-through work in the test centers. So this means that the implementation of this policy required them to make more than simply establishing the policy, which means the entire government system able to work smooth and effectively. And in order to do so, a high level of coordination and cooperation among various actors in both public and private sector seems very important in implementing the policy. Okay, that's all from me, which is highlight about the second last of the criteria of collaboration governance.
Okay, thank you, Al-Haziq, for the great explanation also. So based on the explanation by Al-Haziq just now, and what I could see and what I could perceive started from Safira, continued with Sarah and Al-Haziq, then we are able to acknowledge that South Korea already established the South Korea regarding to the case of COVID-19 pandemic. It truly shows that how South Korea implement collaborative governance to ensure that the pandemic of COVID-19 are able to be handled by them, not only by the South Korea government, but also together participated by many private agencies, and also like what have been mentioned just now by Safira, also participated by the public. So back to Safira again. Regarding to the case study that we have discussed just now, so in your opinion, in your point of view, why do you think that Korea needs to implement the collaborative governance? I mean, that what is the main reason which contribute for the collaborative governance to be implemented? Can you define it? Thank you.
Okay, thank you, Mr. Ashraf. Okay, we back to the case that we choose, which is the South Korea response to the pandemic. Okay, okay, as we see, the pandemic itself is already a reason why South Korea government should implement the collaborative governance. But here, I'm going to point out two main points that highlight in this case, which is the first one is government realized that implementation policies requires more than simply establishing the policies. Okay, in this case, the South Korea government realized that this crisis is a global crisis. It involves everyone. It means everyone is in this crisis, involved in this crisis. So in order to control it, in order to overcome this crisis, they have to work together with other actors, which is the non-state actors. Okay, because the policy that government need to implement is a policy that involve everyone. And in order to control this crisis, which is the pandemic, COVID-19, the government have to work with non-state actors such as NGO, the private companies, and the public especially. So this is why South Korea government realized they had to implement the collaborative governance to overcome this pandemic. Okay, second point is the entire governance system needs to work smoothly and effectively. Of course, okay, this is one of the reasons why South Korea implement the collaborative governance, because they realize this is a crisis, global crisis. Every country faces the same crisis. So they know they have to, in order to ensure that any policies that the government implement to be successful, they have to be more or less bureaucracy. and they can achieve it if they work together with other non-state actors, because these policies that government want to implement to control the pandemic, it's involved, like I said before, it's involved everyone. And in order to control it, the government realized they have to make sure everyone involved in this action, in this policy, to implement it. Okay, that's what I can see in this case. These two main points why South Korea implement the collaborative governance. Thank you, Mr. Ashraf.
Yeah, thank you, Safira, for the great explanation of the reason why we could see that South Korea need to implement the collaborative governance. And what I'm so interesting regarding to the explanation just now, it's about, firstly, we are able to know that collaborative governance in South Korea being implemented because the issue of pandemic COVID-19 is not the state issue or the country issue only, but it is a global issue. That's the first one. And then the second one, because Safira just now mentioned about the less bureaucracy, and it's quite interesting because it may be related with what had been explained just now by Al-Haziq regarding to the second last of criteria to fulfill the collaborative governance. It's about the mutually consensus of the decision making. So that's why when the less bureaucracy being adduced, so the consensus able to be achieved. So that's quite interesting regarding to the reason of needed for the collaborative governance to be adopted or to be implemented by the government of South Korea. Then I would like to jump to the last round of our session today, to Sarah and also to Al-Haziq. Okay.
Ashraf, can you hear?
Yes. But then Safira?
I want to add something
Yes,
about the
sure.
less. Okay. The point less bureaucracy in South Korea actually is a very successful strategy by South Korea. If we see the first wave of the COVID-19 pandemic in South Korea, they able to control the transmission of the virus without implement any lockdown in South Korea. They able to run the business, the entertainment, all the citizen activities can be done like usually, because government successful to control the pandemic by implement the less bureaucracy in their administration, because they work together with other non-state actors. That's why they able to overcome the first wave of the pandemic in South Korea.
Right.
Thank you.
Thank you, Safira, for the great explanation. Yeah, that's what we can see. If we have less bureaucracy and we have more actions in order to solve the global issue, we are not mean that I just want to clarify that we in this part, maybe Safira does not mean that we don't need bureaucracy. You still need bureaucracy, but we have to stress on the words of less bureaucracy. Then we are able to achieve the collaborative governance. Am I right, Safira?
Yes, especially during the global crisis, we have to be less bureaucracy, because this is involve everyone. If we strictly with the bureaucracy, I'm sure any policy are hard to be implemented, because it's took a long time to be implemented because of the bureaucracy. That's why during this global crisis, the government should be more less bureaucracy in order to overcome any pandemic in the future.
All right, thank you, Safira. So we'll try to move fast, okay, because we are running out of time right now. So to Sarah and Al-Haziq, so what do you think after we discuss thoroughly about the case study related to South Korea pandemic, how South Korea government solved the issues of COVID-19? So what do you think about the impact of the action of the collaborative governance? Means that what the impacts that we could see after collaborative governance being adopted, maybe in terms of the service delivery by the governments or maybe another agency. You may start first, Sarah, then continue with Al-Hazi. Thank you.
Thank you for the question, Mr. Ashraf. So before I continue with impact of the to public service in Korea, I would like to give a little bit definition about collaborative service delivery. So collaborative service delivery is a specific mode of governance by which policies are implemented and service are delivered through interaction between two or more state, market, and civil society actors. So I would like to elaborate the impact of public service in Korea in terms of context of co-production. So what is a co-production? Co-production is a practice in the delivery of public service in which citizens are involved in the creation of public policy and service. So it is contrasted with a transaction between based method of service delivery in which citizens consume public service which are conceived of and provided by government. So co-production is possible in the private and non-profit sector in addition to the public sector. So the impact to public service in Korea is through public civil society, which is the effectiveness of the collaborative governance largely depend on public participation and the impact towards them. So the government regard the public as a co-partner, continually emphasizing that their participation is critical. As a result, almost everyone will wear a face mask, avoid to go to crowded areas, and take sanitization measures seriously. For example, social distancing, carrying hand sanitizer, and washing hand frequently. So the quarantine have also been following requirement relatively well due to the public awareness of the seriousness of the pandemic. So the society pressure maintained to rule and norm. The impact of the public service, the impact of the public reflect the service delivery, which means that the people high level of consciousness and their trust in the current policies and effectiveness of the overall government system. So generally, when collaborative government is applied in the South Korea government, this will more easier for public agency and stakeholder to involve and support the policy or rule to solve the problem. At the same time, they can achieve their target during the COVID-19. So that's all from me. Thank you.
Okay, so I will add more about the impact of collaboration governance to the service delivery. So actually based on the impacts, that's mean the result, the output, what had been achieved by the public. So I will explain about the situation, the example by the policy that implemented by the South Korea, such as the transparent public information and well-planned public campaign and education, along with their experience with previous epidemics, have made the public well alert of the situation and better prepared for the type of health crisis. Unlike other countries, no mandatory lockdown was required in South Korea to control the spread of this COVID. And the local business organization voluntarily took necessary action. Schools, workplace, they made the swift transition to homeschooling and teleworking and arrange flexible schedules. Restaurants and shops also have actively taken sanitary measures to ensure health security and then screening, requiring masks at the entrance of building. Many hotels, office, and other large buildings have installed thermal imaging camera to identify people with fevers. This is some of the situation that we can see based on the policy that be made by the collaborative governance. And then for the social distancing and lockdown, actually in the Korea were recommend but not mandate. But with the active civic engagement, the whole governance of disease control has been quick and efficient. A number of local non-governmental organizations, which is the NGO, have also played their role through vibrant campaigns, voluntary activities, and movement to support the national response to the epidemic. They're working with the local government, working closely with local governments and service providers. NGO they led various social distancing campaign, which is they send the voluntary workers to disinfect needed areas, provide emergency kits to people in need, and so on. But civil society organization also include the NGO and trade unions. They also push the government to give proper attention to the vulnerable, such as low-income families, the disabled, and migrants. They have monitored and report condition of living facilities, homeless shelters, and vulnerable individuals at home to the authority and step in to provide the needed products and service when there is a governmental gap. I think that's all from me.
All right, thank you to Sarah and also to Al-Haziq for the explanation regarding to the impact of the collaborative governance, maybe in terms of the service delivery by the government itself. And from what has been explained just now, I could see that among all of the explanation, another part that I could say a little bit, I could elaborate a little bit regarding to we can see that the drop down of the drop numbers of the cases recorded in the South Korea that had contribute to the great management by South Korea governments. Basically, all the impacts that have been explained by Sarah and Al-Haziq just now clearly stated when it comes to the when the government decided to do the collaborative governance, it shows on how seriousness of the government to ask the involvement from not only from the private sectors but also from the public participation, so that they are well acknowledged and they are well aware that their roles give the good impact to the civil society especially. So as what I may conclude from today's discussion is what we today's discussion and also to the previous discussion, we can see that collaborative governance, surely the key point to be highlighted is it must be started by the government, and also it must involve many participants, such as the private sectors, such as the NGOs, and also the public participation also. And we can see another criteria to be highlighted, it must be consensus decision be made by all of the participants who involved in the collaborative governance, and also because the purpose of the collaborative is about the public policy and also public management. And I think that's all for our discussion for today. Hopefully everyone are able to understand about the case study presented by all of us. Thank you so much and have a nice day.
Thank you.